Dr. Maysah Mullah is an RCSI graduate 2014, currently a specialty trainee in cardiology in Northern Ireland and a clinical tuna examiner at Queen's University Belfast. Completed internship at KHUH in 2015 and proceeds with a core medical training in Northern Ireland followed by her specialty training. She is a deputy chair of the Junior Doctor Committee at the British Medical Association and a member of the Northern Ireland Council as well as the trainee committee. It's nice having you, Dr. Maysah, with us today.
Thank you guys for having me. It's a pleasure to be back. I was given a similar talk 3 years ago, so it's really good to be back, and I'm happy that I was invited. So thanks for introduction. My name is Maysah. I'm one of the cardiology registrars currently working in Northern Ireland. And I'll be talking about the training pathway in the UK. So it's a very similar talk to the presentation that I gave 3 years ago, but there are a few updates that we're going to talk about a bit later. Everyone can see the screen, yeah?
Yes, doctor, it's visible.
Thank you. Okay, so just a disclaimer at the beginning. So no funding has been received from any training body for this presentation, and everything presented here today is based on my personal experience. Okay, so the objectives for today, we're going to talk about the GMC registration. We're going to talk about the internal medicine training pathway first. Now, I'm not going to really discuss much about the surgical pathway just because my main pathway was medicine, but it is very similar, and there's some links at the end that you can log into and see the rest of the pathway for surgery. We're going to talk about the application process, the recent updates to the training scheme, portfolio and assessment, and then just a bit about my personal experience. So how do you go about getting your GMC registration? Well, this is mainly for people who are non-UK and non-EU residents, which is the majority of the population in this seminar today. People who graduated from international medical schools like you guys, and people who most likely will do some sort of internship equivalent before applying. So how do you go about getting a license to practice in the UK? Well, so there are a few ways to do it. Either you can go through the PLAB exam, or if you have a postgraduate degree, which we're going to discuss later, or there are certain GMC-sponsored hospitals that would take in international trainees for a fee. So the PLAB exam, it's two parts, a written exam, which is a PLAB 1, and a clinical exam, which is a PLAB 2. Now, the PLAB 1 has changed recently. Back when I did my PLAB 1, it was 200 MCQs. Currently, it's 180 single best answer MCQs, around 3 hours duration. The PLAB 2 is a clinical exam. It's only done in Manchester in the UK, so you have to travel for it. PLAB 1, on the contrary, is done in a lot of places, including the UAE and Dubai. So it's 18 stations, 8 minutes each. And it's very similar. If you're an RCSI graduate, it is very similar to the final exam. And I'm assuming it has some similarities to the AGU final exam as well. It's an OSCE exam. So you have history taking, physical examination, management discussions, and your communication skills, basically. So what sort of postgraduate certificates can you obtain, and that will qualify you to get a DMC registration without the PLAB exam? Well, if you have your membership exams like the MRCP or MRCS, or if you have your board certification, either the American board or the Australian board, then you can skip the PLAB exam and go straight for application to the GMC register. So these are some of the GMC-sponsored hospitals. They're very limited, very minimal, and they have very specific criteria. So if I were you, I wouldn't consider the GMC sponsorship pathway. I'll probably go through the PLAB or the membership exam. So what other requirements do you need to register with the GMC? Well, other than your PLAB or postgraduate qualifications, you're going to need a medical degree, which is acceptable, and both RCSI and AGU are accepted medical qualifications, and you need your English language. So For RCSI graduates, you don't need to provide any evidence of a satisfactory English language exams. Your degree is sufficient. If you're an AGU graduate, you do need the IELTS, and you need an overall score of 7.5 with a minimum of 7 in each of the sections, the writing and listening, as well as the reading. So once you've done all of that, once you've submitted all your documents and you had your exams sorted, you had your English qualifications sorted, then you need to go to the UK for an ID check at the GMC building. You have to do that face-to-face. Now, I'm assuming they still, despite the COVID, I'm assuming they're still doing the ID check in person because their clinical exam is still face-to-face. So let's talk about the training pathway then. Currently, from August 2019, we have what we call the internal medicine training pathway. Back when I did my training, it was a core medicine training pathway, which is a 2-year training. Now it's a 3-year training pathway. This is your general medicine training. So you'll go through specific sets of placements, 4 months each, and that will include your general medicine, geriatrics, cardiology, ICU, anesthetics, and so on. This has been implemented, as I said, just recently, the past year, and the entire pathway changed, not just the core training, but also the specialty training. So back when I did my training, it was the core training pathway, the CMT. So you start your CMT1, CMT2, and then you jump into the specialty training at ST3, which ends at ST7, depending on the specialty. Sometimes it goes up to ST8 for procedure-based specialties like cardiology or gastro. At the minute, they're going with the IMT pathway. So you start with IMT1 into IMT2 and then IMT3, which is equivalent to your ST3 back in the day. The only difference is there are 2 different schemes at the minute. There is the single accredited programs and the dual accredited programs, which we're going to talk about in a second. That will determine how many years you spend post your IMT3 3 years, whether it's 4 or 5-year training. So the application. So obviously the dates have passed for this year. So if you're thinking about applying, it will be for 2022. And if you go through this website, you'll find the dates that are advertised and when to submit your application. Usually application will start around November time, end of the year, and then the posts start usually August the year after. The Oriel system, so this is the electronic system that you will use to submit your application. Everything is online, everything's electronic. All your submissions are going to go through that website. You're going to get your scoring through that website as well. And you're going to get your interviews booked and your final results through that website. So this is the application scoring link. So you can click on that, and then it will give you an idea about how your application is scored. It's usually scored based on your any postgraduate degrees that you've done, your CV, any courses or extra exams that you've performed, any achievements like medals or awards that you've received, as well as research projects, publications, and any extracurricular activities. So what's next? So you've submitted your application, you managed to get a spot for the interview. So it's similar to the interview that I've gone through. So it's divided into different sections. So at the minute with COVID, some of the interviews are still face-to-face, depending on the location, and some of the interviews are online. So there are different stations or sections. You'll get a clinical scenario station where for general medicine, it's going to be something simple like an ST elevation MI or a diabetic ketoacidosis. For your ethical scenario, that's where you need to follow exactly the GMC ethical pathway. and you have to make sure that you actually go through the entire regulations in the UK. Section 3 and Section 4 is basically your suitability for the specialty that you've chosen. So why do you want to do medicine? Why do you think you're suited for medicine? And what have you done that will prove that you are eligible to get into this, the training program? So the interview scoring is here as well. So this is the link where you can click on and have a better idea of how the interview scored. For each station, you're gonna have 2 different examiners or interviewers, and they're gonna score you separately. And then at the end, the average score is gonna be the advertised score. So this is just a bit about the competition ratio for the past year. So in 2020, there were 1,600 vacancies, and the application number was 2,700. So you can see the competition ratio is about 1.7. Now, each year it's a bit different depending on how many people are applying and how many vacancies are there. At the minute, the competition is a bit more, and the reason why is the UK has dropped all the regulations with the visa requirement for international trainees. Back when I applied, I wasn't allowed to apply for round 1. I'd only apply for posts that are left after the UK and EU residents have filled the spots. At the minute, everyone is equal. You can all apply in round 1, and everyone will get an equal opportunity to get a post. Now, this is actually better for you, and the reason why is because you will be applying competitively from the beginning for all the posts available. When I applied, it was way more difficult because there are only minimum number of spots that are left after the UK and EU residents have filled the posts. So the specialty training then, it's ST3 to ST7 or ST8, and that's your subspecialty training. Either again, single or accredited dual training pathway, and we're going to talk about that in a second. For every specialty, usually your ST3, ST4 is the general concepts in your designated specialty. So in cardiology, it would be more of a general cardiology with a general medicine component. At ST5 to ST7, that would be more focused to your subspecialty training. So for example, in cardiology, electrophysiology, so that would be your training mainly in electrophysiology at ST5 onwards. There are options or opportunities to do out of program training. And this is usually people who are a bit more advanced in their training. So usually at ST6 or ST7, people will take time out to do research, for example, or an MD degree, which is a research 1-year degree or PhD. A lot of the trainees here will do an extra fellowship on top of their subspecialty training after ST6, especially for specialties that have more procedure based component, like for example, cardiology. So a lot of the trainees will take time after ST6, go abroad for a year, do extra training in that subspecialty, for example, cardiac imaging, cardiac MRI, or electrophysiology. And most of the trainees here would either stay in the UK and do that, or go down to the Republic. Canada and Australia are very common and popular options as well. So what are the updates? Yeah, so the dual and single CCT training. So dual accredited means that you have a GIM component, general medicine component, on top of your specialty component. And cardiology, as you can see, is dual CCT, so I have to do Gen Med plus the cardiology training. However, cardiology is a bit different because I'm allowed to drop my general medicine component at SC4, just because we have way more procedure-based components that we have to achieve. It is a bit more difficult to do that on top of your general medicine requirement. And as cardiology consultants, you don't cover the general medicine on call, so it doesn't really apply to me. However, the rest of the specialties like endocrine, gastro will be on the dual training pathway, so they have to do Gen Med and gastro. And the consultants will be covering the medical rota as well. Single accredited training programs are like specialties like dermatology, hematology, and ophthalmology, for example. And that is a shorter training pathway because you only need to do 4 years and you don't have to do general medicine as part of your training. So that just goes through the training pathways, as you said. So dual training, you'll do 3 years of IMT, post your internship, internal medicine training, and then you'll do 4 years to 5 years of your specialty training. Now, cardiology is still 5 years, so you'll do 3 years plus 5 years of training, and that's 8 years total. The single accredited pathways like dermatology or hematology, you'll do 2 years of internal medicine training and then 4 years of your specialty training. You don't need to do your general medicine on-calls in your specialty training, and you finish in a shorter period of time. So the eportfolio is an assessment. I'm just aware of time. I think I have 5 more minutes. So this is just your portfolio assessment, what you need to achieve each year of your training. It's very specific, so you can go through that. Your eportfolio, that's my portfolio 4 years ago. So it goes through what sort of assessments you need, your work-based assessments, and you can send tickets to your consultants to fill that for you. That's just an example of that. So my experience, so I graduated from RCSI in 2014. I did an internship at KHUH and an SHO job, and then I did my PLAB 1 in 2016, PLAB 2 in 2017 while I was working as an SHO. Then I did my CMP interviews in 2017, which are equivalent to the IMT. Got my GMC registration 2017 July, and then started the job in 2017. Finished my core medicine training in 2019 August, and I started my specialty training. So a day in the life of a cardiologist, nothing fancy, nothing interesting really. We do ward rounds, coronary care units. I do cardiology referrals, clinics. I do cath lab sessions once or twice a week, echo sessions 3 times a week, cardiac MRIs once a week, cardiac CTs once a week, and obviously the cardiology and medicinal calls. So these are some useful links that I think you should all try to read through. It will help you with your application process. And the guys have my email, so I'm more than happy to answer questions via emails or get advice if you need it. And that's me done. I think I'm on time. Any questions?
Yes, I guess you have like
3
2
minutes?
questions in the chat, Doctor.
Yeah, that's okay. I'm just gonna stop sharing my screen.
From Dr. Zainab Al-Musalli and Dr. Abdulaziz Al-Shamlan.
Fantastic. So let's see. One question, does having step 1 and step 2 USMLE exams? Okay, excellent question, actually. Zainab, or is that Fatima? So having the USMLE doesn't prevent you from, well, so you need the American board. You can't have just the USMLEs to skip PLABs. However, I know that there's some cases where the step 2 CK, CS actually have been used to drop your PLAB 2, but you still need to do your PLAB 1. Does that answer your question? I'm assuming yes. Does it matter if you do your intern year in the UK or abroad when applying for residency? Okay, so it doesn't matter. So you can either do an internship anywhere and then get an equivalent certificate, or you can do your foundation year 1 and 2 in the UK and then apply for core training. If I have MRCS, MRCP, do I bypass the 2-year of FY training? No, you bypass the PLAB exam, but you don't bypass the foundation year. You need to have either an internship equivalent or a foundation year program before you apply for core training. I think that's all the question.
I have a question.
Yes.
Is it okay to have the occupational English test instead of IELTS?
Yes, that's accepted.
Is it okay for AGU students? Because you said AGU students need IELTS 7.5 or...
Either the IELTS or PT are accepted, but you can't use just your degree. You need to have either that exam or the IELTS to apply.
Okay, thank you.
No problem.
Thank you so much. If there's any questions, Doctor, please, if you could chat with them.
Yeah,
Thank you.
thanks, guys.
Thank you very much, Dr. Maysah. Maysah, let me open my screen.
Hi, Dr. Ayqat.
Hello, thank you. Hi. Good to see you here. Hope you're safe.
You.
Thank you very much for sharing. Thank you. Thanks a lot.
Very welcome.
Tawfiq. Thank you very much.
Thank you.
Hello, everybody. I just joined. I'm not going to interrupt the program, just saying hello. I'll disappear again.
How are you, Doctor? How are you?